it's been a long, hot summer, and for many of us, that means yard work, playing with the kids, or maybe gardening. What, can I say that? I'll get it out anytime now. And it can take a toll on your back, that's for sure. Dr. David Freeman with U of L Health Brain and Spine Institute joins us now to talk about how we can manage our back pain. And I just told you, I'm so glad you're here because I am a big candidate with back pain, that's for sure. I've had it for years. So let's talk about folks out there. You've been doing that yard work, pulling weeds. That's one thing I do. I know I'm not supposed to do it, but it drives me crazy and I'll start doing it. What kinds of things are going to cause back problems in the summer? And you know, when do we know if it's like we can rest for a few days and it's gonna be okay if we need to see a doctor?
Sure, that's a great question, Connie. You know, back pain's really common. You've experienced it, I've experienced it, almost everybody has. The things that we really worry about are more than back pain. So if you have pain that runs down your legs, you have numbness and tingling that runs down your legs, or any kind of weakness in your legs, those are things that we would really worry about. And then if you're having problems going to the bathroom as well, if all those things in conjunction with back pain, those would be red flags that we want you to see us for.
Okay. Now, I know I've talked with a lot of doctors over the years, and they always say, you know, if you can avoid the surgery, I'm a candidate, but if you can avoid it, as long as you can, try to do other things and not have the surgery right away. That's something you guys say as well. And what are things that people can do instead of having surgery right away?
Yeah, I mean, spine surgery is really scary. So that's a last resort for everybody. Physical therapy, steroids, injections, and then some pain medications too can be really helpful. And
I know for some people, I try a little bit of everything. Massage therapy might help with physical therapy, stretching, things like that. I know there are classes now for stretching.
That's right, And there's all sorts of stuff like dry needling, you know, acupuncture, ultrasound. So there's a whole host of things. And unfortunately, we don't know which is gonna work for everybody.
Right.
So we gotta try.
So when candidates for back surgery decide to go ahead and do it, what are the benefits for someone to have back surgery?
Sure. So some of it depends on what the problem is to start with. You know, if it's a disc herniation and things like that, surgery can help by removing that disc herniation, taking care of that leg pain that's been bothering people. If it's a fracture, we can help heal that, stabilize the fracture. If there's other more serious things, even like cancer or tumors that are there, we can take those out. Those are the some of the main things that we do.
Now we, of course, hear so many surgeries that have such a quick recovery all of a sudden, like a hip surgery or something like that. But back surgery, it's still a pretty long recovery, isn't it? Most of the surgeries, whether it's upper or lower? Yeah,
that's that's true. There's an exception to that though, and one of those is endoscopic spine surgery. So it's ultra minimally invasive spine surgery that we do at the University of Louisville. It's a centimeter-long incision. We're able to get people back doing the things they love in a couple of weeks.
Wow, that's amazing. Okay, so if people want to learn more, they can always just head to U of L Health and you can help them out?
Absolutely,
Doctor,
be happy to.
Thank you so much for coming in. We certainly appreciate it, that's for sure. We'll still